Hi there. This video is to show you how you might use our prescribing system to record a safe and comprehensive notes-based med review. If you're using our system, hopefully your admin staff are starting to send out med review questionnaires. This can be automated if you want, or they can do it in bulk. When patients answer, if their answers suggest they need to speak to someone or they want to talk to someone, they would drop into reports for admin to send invites to. But about 80% of the time, that's not the case. And so they'd drop into a report like this one. So annual review green, i.e. things are up to date. They've got no bloods or obs that are due for their medication, and they've completed a questionnaire. So to show you how this would then work in an individual patient, I've set up this test patient. I've recorded some bloods. I've put them on naproxen and the omeprazole. And I've come to our prescribing overview template. I've got it on my toolbar. You might want to do the same if you're using it a lot. If not, you can always access it up here. So first of all, we've got the med review status. We can see that it's awaiting pharmacist, or it might be GP review. We can see the recall status, that everything's up to date. So we're happy with that. We can see that they're on NSAIDs. If I expand that, I can see what monitoring is in place, and clearly it's up to date. If you use Ardent, then and there are alerts that they pick up, they'll appear here. We've also got some of our own that are a bit more specific and sort of tie with the pathology parts of our system and the recall system. And then here I can see that, in fact, I have answered the questionnaire for the patient. So normally they'd be texted it, they complete it on their phone, and it comes back in. So you can see that the questions here have been answered. They understand the purpose of the medication. They can take it as directed. Are the medicines effective? No, but they don't need to discuss this. Perhaps they're on the naproxen for pain, but it's not completely managed. Again, some side effects, but not something they want to discuss. If they'd put answers that said, I want to talk to someone, then they wouldn't be in that list to do a notes-based med review. So I've also got down here the current repeats, got some of their more recent results from earlier today, in fact, and previous med reviews would appear down there as well. Over on the right-hand side, I've got all the usual buttons if I want to go to our other templates to see what's going on. Up here, first of all, we've got new repeats, and then if you want to pop out the repeat templates, this button here will let you do that. What you would perhaps do first is you could pop this out, and the advantage of doing that is you can potentially look at, I won't put it onto the other screen, but you could look at the current repeats side by side with this information. And what we would recommend doing is setting review dates to be the last day of the birth month. You don't have to do that, but what we found is that it works really well for a good flow for the patient. So as it gets up to their birth month, they get invited for annual review. They have everything done, they get sent the questionnaire, and then it drops into the report for someone to review and move things on. So if I click on this number 7, you may not use this normally, but it lets me change the review dates. I can put it a bit further forward than I can if I was reauthorizing. And by doing that, I also don't lose the compliance data. If you reauthorize medication in System 1, it's kind of like reading the whole lot, and you sort of lose some of that useful information. You might have spotted here, this patient's got no drug allergy. Again, I can view that here if there was anything to see, or I can use this, no known allergies. Now, it might be that as you look at the meds that they're on, as you look at their answers, that you decide actually this patient does need to speak to someone. And so you've got two quick options here. Your practice might be treating them much the same, but we've separated out a med review, so sort of structured med review, or a med discussion, which might be a shorter appointment, for example, to discuss, increasing their statin dose, things like that. But if I'm not concerned about that, then I would be clicking this one here, record notes-based med review. What the protocol has done there is it's looked at where their place is in the flow of the system. The fact they've answered the question is checked about their compliance. So if they hadn't ordered some of their meds for, I think it's 3 months, it would flag that up. And then it's asking me, do I want to inform the patient I've completed their med review? And I can either do yes, send automatically, which is perhaps what you do once you're used to it. But if you want to review the message, you can do that. So thanks for taking the time to complete the questionnaire. You reviewed your answers, everything's fine. Essentially, that is it. And click send. And now I can see here what's been written into the notes. It's coded that I've done a med review without a patient. If I were a pharmacist or a GP, it would pick that up. And I think there's a code for med review done by GP or med review done by pharmacist, and it would apply that. So the idea is that this process may not actually take very long because so many safety checks have gone up to that point. So they've already had all their annual review done, they've had the monitoring completed, they've had the chance to tell us about how they're getting on, and that's all done. And now that I've coded that, the questionnaire has actually disappeared from this view because it no longer requires action. That part's been done. One last thing to add. If you had done the notes-based med review without first moving on these repeat dates, we're going to set it so the system does prompt you to do that and either take you to this screen or give you the option to record that you're happy for someone in your meds management team, perhaps a dispenser, someone who's experienced, to move those dates on if you've not got the time to do that. And that is critical because whilst the med review codes are important, the broader part of the system is looking much more at these review dates to work out whether patients can order their medication and then also whether staff need directions to know what steps they might need to take to allow the patient to order their medication. That's about everything for this part. Give us a shout if there's anything else you want to know or anything that we can do to develop it further. Thanks.